Morning, everyone. Welcome to day 15 of Acharya Rad Connect 2025, a premier online webinar series organized by Department of MIT, Acharya Institute of Allied Health Sciences, in association with Indian College of Radiological Technology. I am Ruzwan, your host for today. Today, we were thrilled to have with us Ms. Deepika R. She is a full-time PhD scholar at Sri Ramachandra Institute of Medical Sciences, Chennai. Ma'am was the first rank holder in her MSc in Medical Imaging Technology from Mahi, Manipal, and has 1 year of teaching experience. Ma'am has also published 2 research papers in well-known journals. We are excited to have her with us today. So without further delay, let us welcome Ms. Deepika R. Over to you, ma'am.
Thank you so much for this opportunity. Today, the topic is on virtual reality in radiology and simulation in interventional radiology. So first, let me share my presentation. So are you all able to see the presentation?
Yes, ma'am.
Okay. So the topic is about virtual reality in radiology, simulation in interventional radiology. So basically, virtual reality, it is a computer-generated simulation of an environment or experience that can be interacted with a seemingly real or physical way by using a specialized equipment. So you'll have a computer-generated environment that can be created using multiple hardwares and softwares. Okay. So this virtual reality, we have been using this in a lot of different fields, like for education, for entertainment purposes, for gaming. Similarly, you can use this virtual reality for medical imaging also. So in medical imaging, it aids in visualization, it enhances training, and it improves spatial awareness. So before moving on to what this virtual reality is and how it is used in interventional radiology, we'll see about the evolution of VR. So earlier days in 1838, stereoscopy was first introduced. That laid the foundation for your 3D visualization. So stereoscopy is nothing but introducing the illusion of depth. Okay, so you create an image in such a way that you will get the perception of depth by looking at it. Then in 1935, there was something called as Pygmalion's spectacles that was used for a science fiction story, which gave a VR-like experience. And then in 1960s, your early VR devices were beginning to develop. So in 1956, there was something called as Sensorama, which gave multisensory experiences. And then there was early head-mounted displays that was introduced in 1968. Later on, the term virtual reality was slowly started to get popularity in 1980s, and then in 1990s is when your VR was introduced into the field of medicine. So first they began exploring this VR for the purpose of training and surgical simulation, and then they started using it for therapy. So particularly in cases of phobia, there is something called as exposure therapy, which can be used to treat patients. And then in 2000s, there was growing application of this VR. So we started using this VR for 3D imaging and also for surgical planning. And then there was development of VR-based rehabilitation programs. And then in modern healthcare system, that is in 2010s and 2020s, slowly they again started bringing up this VR. So in between, there was a lack of application of VR in medical systems. Like they stopped using it. It was not that very popular. But then in 2010s, again, this VR system was revived. So there is Oculus Rift and other modern VR headset devices that started to use in medical system. So there was increased focus of VR for medical training, for surgical simulation, and patient education. And then there is also augmented reality that started to gain traction. And then in 2020s, during the COVID pandemic time, this VR and AR, that is your virtual reality and augmented reality, was started to use in telehealth and remote training. So there is continuous advancement of VR hardware systems and software with improved realism and accessibility. And these increased integration of artificial intelligence with VR, it gave a enhanced simulation and personalized experience. So this is how VR started to develop and then how it was integrated into healthcare systems. So now we'll see about the different areas in healthcare where this VR system is used. So we can use it for the purpose of medical training. So now VR is widely used for training medical students, residents, and surgeons in a safe and controlled environment. So by using simulations, we can practice complex procedures and we can get exposure to rare conditions which is not seen in the routine clinical setup. And then we can also use VR for surgical planning and guidance. So it enables to, visualize patient anatomy in 3D, so it will facilitate preoperative planning and intraoperative guidance. And then VR can also be used for rehabilitation. So VR is used in physical and occupational therapy to help patients recover from injuries and illnesses. So it will give a gamified VR experience that is more engaging and it is effective for rehabilitation. And VR can also be used for pain therapy. So VR has shown promise in reducing pain by distracting the patients and creating an immersive experience. So once the patients start to focus on something else, the thought about pain, what they are going through, it can distract it from that. And then we have VR for mental health. So we can use virtual reality to treat anxiety disorders, phobias, and PTSD through exposure therapy. And then we can also use it for patient education by visualizing what happens during the procedure. You can help the patient understand what is their medical condition and what treatment options are available. And then you can also use VR for telehealth, that is in case of remote consultations and therapy. You can start applying this VR so that it becomes accessible for everyone. And then now we'll see about how VR is used in radiology. So virtual reality can be used for medical education and training, for interventional radiology, for diagnostic imaging, for patient education and pre-surgical planning. So in medical education and training, for the PG students or the medical students who are interested in knowing about what radiologists, you can use these VR systems to give them an idea on what exactly happens in the department and what are the different procedures. You can give them a basic idea of the concepts that are there. And then in interventional radiology, you can use it for, again, training purposes, and you can simulate the interventional radiology suit to give them an idea what happens during the procedures. And in diagnostic imaging, it helps to visualize the anatomy better. It gives you 3D visualization of the anatomy so you can diagnose better. And again, it helps to educate the patient about what procedure they are going to go through and what happens during the procedure, and then what are the treatment options that they can get. And then for pre-surgical planning also, you can use virtual reality. So with a team of radiologists and surgeons, you can exactly like plan and discuss on what steps can be taken to treat certain patient conditions. Now we'll see about simulation and interventional radiology. So simulation has become an vital component for training and practice in interventional radiology. So it serves as a bridge between theoretical knowledge and practical expertise. So virtual reality is where you have more of a computer-based experience. That is, virtual reality will create an immersive computer-generated environment, whereas simulation is a process of creating a model of a real-world system or process. So it can represent behavior or characteristics, and it can be used for training and for analysis purpose. So you'll require different computers' physical models to replicate the aspects of the real-world scenario. So why is simulation important? Why do we require this simulation? So simulation is important for learning about these complex and rare procedures. So there are certain patient conditions or certain pathologies which we cannot find in a routine practice. So it happens like very rare and only few cases are available, and not everyone is trained in that kind of procedures. So when there is intricate complex procedures, you can use the simulation so that you can improve hand-eye coordination, spatial awareness, and rapid decision making. So whenever there is high-risk procedures, there can be chances of error when you're directly going to do the procedure on the patient. Instead of that, you can practice this procedure in a simulated environment so that you can ensure patient safety is there, and You can also minimize the risk of radiation exposure. So by relying on this simulation, you can reduce exposure to both patients and the practitioners. So it will allow the trainees to practice procedures and develop proficiency without unnecessary radiation exposure. And you can develop skills, that is, your simulation will help to practice and refine certain fundamental skills like catheter and wire manipulation, angiographic techniques for interpreting images and for managing publications. And then it will also enhance teamwork and communication. It will improve your team coordination. So usually your interventional radiology procedures, it will involve multidisciplinary teams. Okay. So simulation will allow for team-based training so that you can improve communication, coordination, and teamwork among radiologists, nurses, and technologists. So now we'll see about the different types of simulation that can be used in interventional radiology. So basically we have 4 types. We have virtual reality simulators, we have physical simulators, computer-based simulation, and contrast reaction simulators. So first is virtual reality simulators. So it will give a complete immersive and realistic experience. Okay. So this VR simulators, it will provide a fully immersive experience so that the trainee can be in a virtual environment that mimics your IR suit. So in virtual reality simulation, we have high resolution displays and 3D rendering that will create a more realistic anatomical visualization. And then we have something called as the haptic feedbacks. Okay, so haptic feedback is a technology that simulates the sense of touch by providing users with tactile sensations. So you'll get different types of haptic feedback systems. We have vibrotactile feedback, we have force feedback, electrotactile feedback, and ultrasonic haptics. So these feedback systems will replicate the resistance that of catheters and wires when we are trying to insert or when we are trying to catheterize the patient. And we also have specialized gloves that will provide the sensations. So this VR simulators, it can replicate a wide range of procedures from your basic catheter manipulation to complex interventions like embolization and stent placement. They can also simulate potential complications, thereby allowing the trainees to practice managing adverse situations. Just a minute. So going back to this virtual reality simulators, we have software and scenario libraries. Okay, basically you'll have a wide variety of options to practice what kind of procedure you can do. So VR simulators, it relies on sophisticated softwares that will simulate the behavior of tissues and devices. And we have scenario libraries that will provide a diverse range of patient cases, so exposing the trainees to various situations. So it is basically like a gaming setup. Okay, you'll have different levels or different options, so you can select one of the scenario and then you can try to practice how to do that procedure. And this virtual reality simulators, they have certain advantages as well as disadvantages. So the advantages are, it is a highly realistic and immersive experience. It allows for unlimited and repeatable practices, so you can practice the procedure again and again till you gain confidence. And it provides objective performance feedback, and it reduces the need for cadavers or animal models. Whereas it has certain disadvantages, like it can be very expensive to acquire and maintain. It requires high performance computing systems, and this haptic feedback, it may not perfectly replicate your real world scenarios. Next, we have physical simulators. So basically your physical simulators, it uses physical models of various organs or systems, often made from silicone or other materials, which will mimic your anatomy. Okay, so for example, if you want to practice procedures related to liver, you'll have a physical model of the liver with all the bile ducts and other arteries, veins, and everything. So you can practice doing procedures on these physical models. So you can practice how to manipulate catheters and guide wires in a hands-on manner. And these physical stimulators, again, it will provide a tactile feedback system which gives a more realistic experience compared to some of the VR simulators. So you can feel the resistance of the vessel while you're trying to move the devices. And these physical simulators, you can integrate it with imaging softwares, imaging systems such as fluoroscopy, allowing for trainees to practice a image guided procedure. So you have your model as well as your fluoroscopy system so that you can see how the catheter or the guide wire is moving through the anatomy with the help of images. So again, this physical simulators, it has certain advantages and certain disadvantages. So the advantages are it provides a realistic tactile feedback. It is relatively inexpensive when you compare it to your VR simulators because the simulator itself, like the VR simulator, you have hardwares, the head-mounted displays, and other softwares and things like that, which are expensive. Whereas in physical simulators, you'll require the model and then the imaging system that you already have. So it is kind of inexpensive and it is very easy to use and maintain. It has certain disadvantages. So there is limited ability to simulate complex anatomical variations. So it is not always that the patient has, the normal anatomy. Okay, there are certain anatomical deviations that can be present, which cannot be manipulated in this physical simulators. The physical simulators will always give you a standard model of the normal anatomy. So it will not have any variations. So when there is cases where there is anatomic variations, you may not be able to practice it using this physical simulators. And it may not provide realistic visualization of the internal structures, and it has limited ability to simulate complications. Then we have computer-based simulation. So in computer-based simulation, it has an interactive software. So using this interactive software, you can simulate the interventional radiology procedures. So the trainees can manipulate the virtual catheters and wires using a mouse or keyboard. So basically you'll have control keys, okay? So you can use those keys or your mouse to guide your catheter into the artery or to manipulate it within the artery. Then these simulations often use 2D or 3D representation of anatomical structures. And this computer-based simulation, you can use it as a educational tool to teach basic concepts and techniques. So when you want to talk about the basic catheterization, the modified Seldinger's technique, how to do it. So for those purposes, you can use this computer-based simulation. So again, it has certain advantages and disadvantages. So the advantages are it is relatively inexpensive and accessible. You can use it on a standard computer, no need of additional softwares and hardwares and advanced systems. And it is very useful for teaching your basic concepts. Again, it has disadvantages because you're just using computer software. You might not get the actual realistic experience. So it has limited realism and immersion. There is lack of haptic feedback and there may not be accurate simulation of the complex procedures. Then you have contrast reaction simulation. So this is particularly useful for emergency response training. So in case you're doing an interventional radiology procedure where you're giving contrast, so the patient might develop some contrast reaction and you might not know how to react. So this contrast reaction simulation will focus on training the medical staff to respond effectively to these adverse reactions. So they can involve simulated patient scenarios and playing exercises. So you can, try to simulate what happens during this contrast reaction, like how you can treat the patient, what can be done. And it will help to, increase the team coordination and communication during such emergency situations. And it has advantages of preparing the medical staff to, react during these critical situations. It improves team coordination and it has certain disadvantages like it may not fully replicate the stress of a real world emergency. And other than these simulations, there is also hybrid simulation where you can combine two of these different simulations to create a better experience. So now we'll move on to the technical considerations, like what are the equipments required, what kind of software you'll require. So before moving on to like what exactly is there, we should know what technical considerations to be taken into. So there is like these are the key technical considerations that you should take into account before creating all this, simulation models. So the first thing will be latency. So you'll have to minimize the time gap between, the physical procedure and the replication of it on the system. Okay. So by minimizing the delay between the user action and the feedback, you can create a better realistic simulation. So you will require optimized hardware and software so that the latency period is less. And image fidelity. So you will require high resolution 3D models for accurate anatomic visualization. So by having a better 3D models, you can, realistically bring out the tissue textures and blood flow. Then haptic realism, this is a very significant technical consideration. So you should get the sense of touch. Okay, so providing a realistic tactile feedback is very essential and it requires advanced haptic devices and software. Next is data security and privacy. Just for the sake of, using the patient data in simulations, it doesn't mean the data can be, misused. So the patient's data has to be protected and it requires security measures and compliance with regulations so that the data is not leaked. And then interoperability. So you have to ensure compatibility between different hardware and software components so that you can use it in a better manner. And it has to be integrated with your existing hospital information system so that different devices can be used. Next is the technical requirements. So these are the list of hardware and software required for this simulation in interventional radiology. So we have the first thing is a high performance computing system. So you'll require this, like you'll require a high GPU and a fast CPU as well as enough storage space. Then we'll require VR headset. So this VR headset is basically a head-mounted device that will have a optic display so that you can visualize the virtual reality environment. Next is your haptic feedback systems. So these haptic feedback systems, again, I've already told, we have vibrotactile feedback, we have electrotactile feedback, ultrasonic haptics, and force feedback. So basically in your interventional radiology simulations, we'll be using this force feedback system. So it applies forces to the user, which will simulate resistance, pressure, or weight. And then we have tracking systems. So these tracking systems are essential to know where you are, inserting the catheter, where the catheter is going through. And then we'll require medical imaging systems so that you can see the images, you can create 3D models out of it. And there are certain like these are the software requirements. So we'll require VR development platforms. We'll require medical image processing software. We'll require simulation software and networking capabilities. So next, these are some of the simulation platforms that are available. We have something called as Angiomentor, CAT-Train TM. We have Mentis, Immersive Touch, Brain Lab, and SimX. So these are some of the platforms that are available, which provide modules for training in the interventional radiology suite. So other than this, we also have certain simulation platforms for gaining surgical competence also. So this is one example of how the simulation will look like. So basically, this is a Prosedicus WIST system from Mentis. So it is a multimedia device that is designed to simulate your endovascular procedures. So it includes a wide variety of clinical scenarios like carotid, renal, and iliofemoral occlusive disease. So this system basically, you have your standard desktop, and along with this, you'll have software that contains a 3D representation of human arterial system. So this can be coupled with your haptic module utilizing a force feedback system. So you'll have external input devices. So here you can see this is the model of the patient. So you can connect external input devices to this so that you can, use catheters, stents, guide wires, and contrast to simulate the actual interventional procedure. So here you can see one system, it is the normal desktop that you use, and the other one, it will simulate or it will display your fluoroscopic image on this secondary monitor. So here you can see they're trying to catheterize the carotid arteries, and that can be done using this type of simulation device. So now we'll move on to the benefits of simulation in interventional radiology. So enhanced skill development. By continuously practicing, different procedures, you'll get a better skill of how to do these procedures. And next is improved patient safety. Instead of, actually going and performing the procedure on the patient, you can try to, practice in simulation so that you can ensure the patient safety is maintained when you're actually performing the procedure. And these interventional procedures, you generally require high technical and precise motor skills. So the simulation will provide a safe environment to practice and refine these skills. And it will allow for repetitive practice of complex procedures, enhancing proficiency. So you can minimize the risk to the patient during training using simulation. And you can also enable the trainees to learn from mistakes in a controlled setting. And you can expose the person to diverse scenarios. So you can replicate a wide range of clinical scenarios, including rare and complex cases. And you'll have a standardized curriculum. So simulation will provide a consistent platform for training, ensuring that all trainees receive standardized instruction. So it will also help to make better decisions in stressful situations, and it is also cost effective when you compare it with animal models and cadavers, which you have to spend a lot of money on. Simulation is relatively a cost effective training method. Next are challenges related to this simulation systems. So haptic realism, it can be difficult to perfectly replicate touch. There can be uh, challenges with image fidelity. So to achieve a photorealistic visualization, you'll require, high-end softwares and hardwares, which is still developing. And there can be delays which will disrupt realism. The equipments that we use are high-end systems, so it is costlier to buy and to maintain. And curriculum integration, it is difficult to fit different procedures into a single curriculum, and you'll require specialized expert training to allow trainees for teaching them this simulation. And objective evaluation is challenging. And space and resources, this kind of setup will require a dedicated space, and equipment requires upkeep. You have to properly maintain, or else there are chances these equipments might have certain faults. And patient data needs to be protected. Data security is one more challenge. Simulation sickness, some users might experience certain discomfort when they're using all this virtual reality systems. So if they are using this head mounted displays, there are chances they might find it uncomfortable. Skill transfer validation. So you have to make sure whatever the trainee is performing during the virtual reality simulation, right? That has to be translated into real world. So you have to make sure they gain that skills and they are able to perform these procedures in real world. And you need consistent protocols. The simulation training, it has to be standardized so that everyone knows what curriculum is there, what can be done. Next is future directions. So what else can be developed in the simulation? So you can improve haptics. So advanced haptic systems, it will provide a more realistic tactile feedback. So you can feel the subtle variations in tissue resistance and device manipulation. And you can develop more sophisticated haptic gloves and exoskeletons so that you can get the actual sense of touch. You can improve your photorealistic visuals. So continued advancement in graphic processing, it can lead to more photorealistic 3D anatomical models that can be used in the procedural environment. And real-time simulation of blood flow and tissue deformation will also enhance this realism. And multisensory integration. So till now, whatever we have is the sense of, seeing and touching. So by incorporating other sensory modalities like auditory and olfactory feedback, we can create a more immersive and engaging simulations and increased accessibility and affordability. So if we go for cloud-based platforms, we can make the simulation more accessible and affordable, allowing for trainees to access training from anywhere. So by making this simulation cloud-based, we can reduce the hardware requirements and also reduce the cost. And we can also have mobile VR or AR, that is mobile virtual reality or augmented reality systems. So it will enable a portable simulation training, and this will facilitate on-demand training for skill maintenance. Next is integration of artificial intelligence and machine learning. So basically, you can use artificial intelligence for adaptive learning. So this AI-powered simulations, it will assess the trainee's skill level, and then it will adapt to that person's skill level. So it will provide a more personalized feedback and a customized training scenario. So this will machine learning algorithms, it will analyze the trainee's performance, and then it will identify areas where the trainee needs improvement. So that area again, you can, train the person again. Automated scenario generation. So you can automate different scenarios and challenging simulated scenarios so that you get a wide range of clinical situations to which the trainees will be exposed. So then there is predictive analytics. So AI can be used to analyze simulation data, and it can predict the trainee's performance in the real world procedures. So this will enable early identification of trainees who may need additional support. So there have been studies where they have used this simulation and VR to train students who had no prior knowledge of what these interventional procedures are. And then they found out that by giving this VR training, the people, they can perform the procedures better and they get a better grasp of the concept. Next is expanding these applications. So you can have remote collaboration. VR and AR will enable remote collaboration between trainees and experts, facilitating mentorship, and it will help in knowledge sharing. So remote simulation sessions, you can access across geographical boundaries. So person from anywhere can access these simulation, modules, and they can get trained to perform the procedure. Next, personalized medicine, patient-specific simulations. It can be used to optimize your interventional radiology procedures, thereby improving the outcomes. This will also allow for virtual testing of devices and techniques before you can actually implement in the real world. And then interdisciplinary training also can be done. So till now, what we saw is like training for one person. So by improving the present hardware and software, you can facilitate a interdisciplinary training, thereby improving communication and teamwork among radiologists, surgeons, and other healthcare professionals. And you can also use augmented reality guidance during live procedures. So augmented reality is where you can overlay your 3D data onto your real-time imaging data, and then you can have enhanced guidance during interventions. So that is all about this topic. Thank you. So if you have any doubts, you can ask. Any doubts?
If anyone has any doubts, put it in the chat box. Ma'am, one of the question is currently where this AR and VR technology is used in India.
Okay, so from what I know, in Ramachandra we have a VR lab where we are training students on different procedures, and for basic teaching of anatomy, pathology, and things like that. Also, we are using this VR technology. Other than that, also we have different hospitals and places where this VR and AR is being used.
Ma'am, one more question is can you brief about AR?
Okay, so AR is nothing but augmented reality. Okay, in virtual reality, you will have all this head-mounted displays. So you will be entering into the virtual reality environment. Whereas in augmented reality, in your real world, you can overlay the digital data. That is, for example, have you people heard about Pokemon Go? I hope like everyone is familiar with Pokemon Go. It is a game where you try to go and catch all these Pokemons. So in real world, you have these Pokemon displays, right? That is how this augmented reality works. So you have the real world situation, and then on top of that, you can overlay all this digital data. So, for example, in case of performing any procedure or anything, you have the patient on the table. So their previous, CT or MRI data that can be digitalized into a 3D model, and that can be overlaid so that you can plan how you can do the procedure. That is how this AR works. Yeah, like actually you have there is this question about possibility of using physical computer and VR simulated combination. So that is what this hybrid simulation is all about. So you'll have your physical models that can be connected to different computer systems as well as your VR simulation, so that you can catheterize on the physical model that can be visualized on your VR headset. Okay, so it is possible to combine all these. So next, there is one question about advantages and limitation of these technologies. So I've already discussed. Again, if you want me to go through it. So advantages, you can enhance skill training. So the person like the PGs or the surgeons, they get a better training since they'll be practicing it again and again. And it will ensure patient safety. It is also useful to go through all these rare cases which is not seen in routine scenarios, and it has certain limitations also. It is kind of very costly to use and maintain, so you may not be able to use it all the time, and to maintain these devices you will need to take a lot of precautions, so that limitation is there, and it is not actually widely used right now, so it has limited access also. Any other queries?
If there are no further questions, we can wind up for today. Thank you, ma'am, for the insightful presentation. As technology continues to advance, it has brought innovations such as virtual reality into various aspects of our lives. You have given an excellent overview of how VR can be applied in the field of radiology, showcasing its potential to transform medical imaging and enhance both diagnostic accuracy and patient care. Your presentation was truly enlightening. Before we conclude, let me brief the participants about the next speaker for tomorrow. We shall have among us Mr. Bindu Prakash. Sir is an assistant professor in the Department of Medical Imaging Technology at Chakos Institute of Allied Health Sciences, Mysore, who will be sharing his insights on diffusion tensor MRI and fiber tractography, an important topic in medical imaging. Once again, our sincere thanks to our distinguished speaker. for sharing such valuable insights to us, and to all the participants for their active engagement today. We hope that you found the session both informative and useful. We look forward to welcoming you again tomorrow for another enhancing session. See you all tomorrow at 11 a.m. Until then, take care, stay safe, and have a wonderful day.